I promised more fertility questions, and here they come. I actually answered this question in clinic today. So, although this question came from our audience at our last presentation with Deloitte, and whoever asked the question may recognize the question, I actually also had to answer this question in clinic today. So, I find it really important for people to understand the answer to this question. The question is, can you get fertility testing when you're not actively trying to get pregnant? This could help with decisions about freezing eggs. This person is very smart, absolutely. So, can you get fertility testing when you're not actively trying? Yes, you can. So, what does that involve? It involves seeing your family doctor or your OBGYN or potentially referral to a reproductive endocrinology and infertility specialist. That's someone we call an REI or an infertility doctor. You don't need an infertility doctor. Your OBGYN could do it, or even your family doctor if they're prepared for that. And it essentially involves a couple of things. It involves blood work that looks at hormones and an ultrasound that looks at how active the ovaries are, and then potentially the anatomy of the uterus and tubes and whether the tubes are open. So it takes three things to get pregnant. It takes good sperm, that's a semen analysis. It takes open tubes, that involves a dye test, a hysterosalpingogram, or a saline infusion sauna. One way to see if the tubes are open, there's a couple of different tests that can be done, but picking one way would be reasonable. And ovulation or ovaries. So sperm, tubes, and ovaries. And to evaluate the ovaries, it involves an ultrasound and, more importantly, blood work. So what is the FSH, the hormone from the brain that's pushing on the gas pedal for the ovaries? What's the FSH? What's the AMH, which is a hormone that comes from the ovaries that gives an idea of how responsive the ovaries are to stimulation, and then a few other tests. So to have those tests done when you're not actively trying to conceive, but you're thinking about conceiving, or you're thinking about whether you want to freeze those eggs, is a really good idea. And I strongly recommend that women who are mid 20s, late 20s, thinking about their reproductive potential, have that testing done and consider freezing their young eggs. If you don't have a partner and you're pushing late 20s, early 30s, you don't want to miss that boat. So having that testing done, considering oocyte cryopreservation or egg freezing is a really good idea for young, professional, highly proactive and intelligent young women to consider. I think it's really underutilized and should definitely be something that's on people's radar as women get older.